morning. This is Tina Drago coming to you live from Beasley Broadcast Studio A. Today I have as a guest Emily Higbee. Emily is a phenomenal woman that has started the Asian Community Resource Center. Good morning.
Good morning, Tina.
Tell us what the Asian community, and I know we have a Filipino community center and a Chinese and a Japanese and everybody's segregated. You are not?
No, we're not. We're actually what the name says, the resource center. I like to tell people lately that we tell people where to go. Exactly.
You say that with a tongue in cheek, like we tell you where to go.
We tell them where to go. Actually, we are a resource center where we help the people in the Asian community, not just the Asian community lately, but also the Hispanic and the African community as well, and the refugees that are coming into Las Vegas. We help them navigate through this combobulated society of ours.
Is there that big of a demand? Do we have enough Asians in Las Vegas to justify an entire resource center?
Yes, there are. Actually, we just had the latest demographic study saying that we are 41% of the population of Las Vegas.
Is Asian?
Is Asian, right? AAPI, Asian American Pacific Islanders.
So does that include the continent of China also, or is that like Japan, Thai, Laos, Philippines?
Southeast Asia, Central Asia. Don't forget Central Asia, like Russia, the former Russian. That's an Asian.
Those are
country.
Asians.
Yes.
And Indians.
And
the
India.
India population is also considered Asian, right?
Yes. And then don't forget the Pacific Islanders.
Well, when you group them all together like that, then I can see that that's a pretty big population.
Correct.
And you mentioned refugees. I know that Las Vegas has 2 refugee points here through Catholic Charities. You work with them?
Yes.
And ECDC?
Yes, we do. We help them. For now, we're just helping them get through after they come here. After about 6 or 8 months, then they have to find insurance. We find jobs. They find clinics.
First person. Yes, first person complete care.
Yes.
And we do see a large population of newly immigrated people here to the country. You know, what's funny is that I grew up here in Las Vegas, so I think Las Vegas is normal. But when everybody's like, what? But when I went away to college, I went to the Midwest. I was culture shocked. So for me going from Las Vegas to Wisconsin, I can't imagine somebody coming from Somalia or coming from India or coming from other countries where they speak a completely different language coming here. How do we deal with that culture change and shock? I mean, I know they want to, they feel it's a new beginning, but what kind of resources do you help them with?
It takes baby steps, anywhere from the social services, like our government's medical, the SMP, the SHIP, for the senior citizens. And then we have the medical services, like you said. We have to find clinics for them. And the first person has been great helping us with them. And then, of course, then there's the financial services.
Right.
What do they do if they have to go to a bank? They don't know which bank or what even to do first step to open a bank
because
account.
banks are really an American and an Eastern or Western European invention.
Correct. Yeah, we don't we tell them not to hide our monies in their mattresses anymore. There are banks, and then they have to take out mortgages, and even to the point of we have to help them out with legal, signing their apartment contracts, signing their lease contracts on a commercial building if they want to open up a business.
So do you do language translations for them?
Yes, we do. Yes, we have community members that help us as well as licensed translators and interpreters.
So how many different languages do you come across?
Oh, goodness.
I didn't get a number. I got an old goodness. Okay.
In our office alone, we have about 7 already among 4 people.
Oh, wow. Okay.
So we have different, we're not just talking about languages, we have dialects as well as from different countries, So let's just say Chinese. When someone says Chinese, you just think of one. But there's Mandarin and Cantonese. And then you have Hokkien, which is what I speak, which is a dialect. Then you have another dialect among the Hmongs. Mm-hmm. And then, we go from there. So,
wow.
So several languages that we have. For every country, there's at least 4 or 5 different languages within the country.
And we wonder, it's not like Spanish, guys, where it's like one language over multiple, and it's like English with different accents.
Correct. Yeah. And the same thing with the Hispanic community. They have different accents. Like Puerto Ricans speak faster than the Mexicans.
Oh, they
and
speak
the
like they're
Cubans.
running.
Yeah.
They do.
So we have the different, like the Mandarin and the Cantonese, they two different languages as well. And then we have the Vietnamese and the Laotian, the Cambodians. And then we have the Nepalese, the the Indians who speak Farsi and Hindi. And then we have our community here, latest community is the Bhutanese.
I love the Bhutanese. Happy people.
Yeah.
They are. They come to the clinic all the time, and they come in groups.
Yes.
And I love that. They're enjoyable.
The Asian mentality. We do herd mentality. We can't just go one person. We have to have 3 or 4.
It makes it actually easier on us because we really strive at the clinic to be culturally sensitive. And we have to take a mini course on each culture to understand what is and isn't acceptable. And it's funny because sometimes we need to have the men with men and the women with women, and that's you can't have a woman walk into a man's exam room on some of these cultures, and you have to respect that. You can't just say, well, when you're in America, because it could be religious, it's cultural, it's all these things that run so deep and are ingrained in them.
Right.
That you want to respect them and make them feel comfortable. And like you said, baby steps over time. Maybe they'll say hello to a woman doctor.
Yeah, that's true. That's true. Yeah, one of the things we do at the center is before we send them to you, for example, at first person, we try to do some sort of an interview first. And one of the things we do ask is, would you mind seeing a woman doctor if it's a male client?
Or for a woman, a man.
Exactly,
Yeah.
exactly. And then we pass that on to you or to even the attorney or to anybody. Even sometimes attorneys, they don't want to go see if the male or female, the difference in the sex and the gender. So that's what we do at the center. Is we, preview them for you?
Do you work with like domestic violence or cultural things like that? I mean, that's the ugly side of it, but it's true that they need to. The women are no longer their chattel. Their families they don't own. When you come to America, some of the children or the wives may want to do more because they have this opportunity for the first time. The husbands may not be happy with those choices.
Unfortunately, and I might get in trouble for this line, but a lot of the female population are coming from the Southeast Asia countries. That's become the problem because the expectation of the submissive Asian woman is still here.
That's Hollywood stuff, though.
I know. And we wish we could remove that stigma, but unfortunately, that's still here. I just had 5 cases of DV that past 3 weeks. And I just spoke with the director of Safe House, and she just told me, Emily, last year we only had 1% Asian population, and from January, it was up to about 4%. That's a lot.
That is, it's a large increase, but it also signifies 2 things. I mean, I say yes, it's a lot, but to me, I look at it as from a different perspective. It was probably still always going on before, but now it's being recognized.
Correct.
People are looking for help. It didn't just happen. People just didn't decide to have this, the domestic issue come to the forefront. They're now speaking about it.
Correct.
So that's a plus, and that's a big hoorah for Safe Nest and organizations like yourself that can get people to feel comfortable enough to actually ask for help.
Right.
So,
that's true.
I always like the glasses half full, but I like to think some of these people are trusting enough now that they're going to say, hey, I need help. And I understand culturally that this isn't acceptable anymore.
Correct. Yes. And we're very happy to get them to the center.
So you do legal, you help them with finances, you help them social,
medical, definitely.
So we'll talk about medical in a second, but on the social, what's the biggest cultural hurdle that you find people have when they come to Las Vegas?
Oh, other than the gambling aspect.
Asians and gambling. Right. So, okay, enough said.
No, I don't think they have that much problem in social other than the interaction among other cultures, especially with Americans.
So you say they say isolated in their groups?
Correct.
Yeah.
Yeah. They still the shy, supposedly, but they're not shy when they are among their community. But when it comes to the Caucasian community,
so they're really not shy. They're just disinterested in talking to us.
Not disinterested. I think it's because they're not sure if they are going to say the right thing or the right word.
I understand that 100%.
Pronunciation, something like that. So they tend to just stay within their own. Maybe that's why, too, they always come in 4s or 5s so that they can talk to each other.
Well, that would make sense.
Right.
I mean, when I go to South America and Central America, I speak and understand Spanish, but I am very quiet when it comes to speaking Spanish because I want to say it just right.
Correct.
And then they laugh at me because they say I sound like I'm speaking like proper English, in Spanish because I learned Castilian. But I understand everything. So when they're talking to me, I get it. But I get all tongue-tied. So I can appreciate somebody not wanting to speak English if they don't feel they're doing it properly. Even though we would love to hear anything, and I'm sure when I go to Spain, like in South American countries, they would just like to hear me speak so they have an idea.
Correct.
So
yeah.
I got that. Okay.
So you understand.
I understand. Yeah.
There you go. So so we do help them and we tell them one of the main problems, and I know we're going to talk about medical lately.
Well, yeah, we
later.
can talk about it now.
Oh, no, one of the problems we had when we started sending people to clinics like yours, like First Person, is they were afraid to see a doctor because maybe they had an immigration problem of some sort.
Yeah.
So we really have to tell them, no, the doctors...
We are document blind.
Correct.
We are when a provider at First Person or when the front office asks you for ID, it's just because we want to be able to the next time you come back know who you are. So we have like your picture next to your name and we can say hello, how are you, and make you feel welcome again.
Right.
Yeah.
But that's very difficult to say to them.
Yes.
Don't worry. It's not maybe them personally, but maybe
a family member
or a friend they know, and then they'll slip and they'll say something to the doctor, and they think the doctor's gonna quickly pick up the phone and call you SCIS. But we tell them
we don't like immigration at the office. We really do. We don't. We are so document blind to that. In fact, that's some of our biggest hurdles when it comes to medical care is trying to figure out how to get them the care they need. Our patients who are undocumented, because primarily. It's not always a money issue. It truly isn't, because we find that the families circle around them and pool their money and will help where they can. It becomes having them trust us to go to maybe a hospital to get a procedure done or to go to a specialist, even though every doctor is document blind. No doctor is ever going to pick up the phone and say something.
I'm going to say we should repeat that. Yeah.
Every doctor is document blind. No doctors like money. Doctors don't care about your licensing or your, if you're uninsured, they're going to say, okay, I need X dollars, and they're going to move on because they're about taking care of the patient. Plus, there's this whole thing called HIPAA.
Right.
And if we pick up the phone and discuss somebody's care with somebody outside of their circle of approval, that's a HIPAA violation, and that's a huge penalty for providers. So that in and of itself should should make a patient feel much more comfortable about coming to a provider because we cannot discuss with them.
And we practice HIPAA as well in our office. We discuss their cases behind closed doors, and every single document that we get from them, we usually don't make copies except for their intake.
Right.
And it's in a lock cabinet so that we don't discuss. Even if they bring a friend, quote unquote, with them,
right.
We have to ask permission to make sure we can discuss their problems in front of the friend or whoever their family members are with them.
Yeah.
So we do practice HIPAA.
Even spouses have to have approval before a spouse can know.
Definitely. And I just want to add on, Tina, one of the things that I have tried to really put out there for the Asian community is the preparation of documents like medical power of attorneys, the living will, and last will and testament. We prepare all those for them for free.
No wonder you're so popular with everybody outside the Asian community as well. That is a huge service.
Yeah. But, I mean, they can go to an attorney if they want to, but my forms were approved by a couple of our attorneys, and they are with the state of Nevada, in the state of Nevada, and so I just provided for them. But we do teach them that these are documents that they have to have.
Yes.
Especially with the medical power of attorney.
Yes.
So we do provide that service as well. It's free. We just ask, sometimes they'll say, how much do I owe you? And we say donation.
Right. Donations are always acceptable.
Exactly. Yes. We have boxes all over the office. And so we do provide that other than, excuse me.
So how do they get a hold of you? Who do they reach out to? Do they just call Emily? They get on the phone and say, I want to talk to Emily Higby at the Asian Community Resource Center?
Somehow they Google me. No.
Are you Googled?
Yes.
I love that.
You do Google. You can Google me.
I don't speak English, but I know how to work the internet.
The Google?
I love it.
Yes.
Yes.
No.
Resourceful.
Most of the times, our Asian community love their newspapers. So we always send an article or two to our Thai, the Chinese, the Japanese, the Vietnamese, Filipino newspapers.
We've been published in those newspapers, and I'm afraid because I have no idea what they're saying about me.
It should be in English, but
no, like the Chinese newspaper.
Oh yeah, no.
Good luck.
They translate. I know. Good luck on that one. No, but we do have some trusted newspapers out there, and the nice thing about Asians is that they do believe. No offense to RJ, but they do believe in the newspapers of their community.
Their community,
yes.
Yeah. And it's easier to read and understand.
Right. And they keep it for years. We have had clients.
So forget the yellow pages. They just go to their newspapers.
Yes. And they read an article about you, and then they keep it. We've had clients come to the office, and I'd say, "Wait, I didn't send any article." They say, "Oh, here," and I'll see that it was in 2014.
I love
newspaper. And so you're saying, okay, it's all right, that. So I just.
So what we're telling you is you get your money's worth in advertising in these Asian papers.
Yes,
they do not throw them away.
No.
So think about that, people.
And they send it to grandma. Somewhere else. Like we have had calls from Massachusetts and other states, and they say, "Do you have an office here?" And we say, "Where did you get? You were calling from where?" And they said, "Oh, my daughter sent it to me, or my niece sent it to me." So they spread the word about you once you've earned the wonderful word of trust.
Trust is huge.
Very.
Yes.
Very.
And you don't get to break it and come back.
No.
So
no.
Know that it's a valuable resource in the
Correct.
community.
Once we say,
How long did it take you to get that trust that your word was gospel?
Well, we're 3 years old now. We just turned 3. And it took us about a year or so. What we did was we attended, oh my gosh, we were attending every event there is in the Asian community and showing ourselves and, bringing our brochures, our flyers, and telling people who we are. And
I remember those good old days. You were a social butterfly.
I know. Nowadays, it's like, really? I have 3 events this Saturday. But we earned that trust by being that, and then proving ourselves.
Right.
Yeah, follow-ups that we've had. We've had some, ups and downs and mishaps, and oh boy.
Well, that's just growing pains.
Right, but when and I'm going to give this example because we did send some clients to some other clinic and they had a problem. But the clients did not go back to the clinic. They came back to us
and
told us, and because the words were, "You sent us there." So that was just the trust factor.
Right.
Right there in those words.
So you needed to change it.
Oh, of course.
Yes.
Yeah, most definitely. So whenever we partner with someone, and I call them our friends of ACRC, I do meet with the people. I do talk to them. And if I can, I visit the facilities if they have a facility. And we check them out. Of course, yeah.
So you're located over on Maryland Parkway, right by Sunrise, between Sunrise and Sahara.
Between Desert Inn and Sahara.
Desert Inn and Sahara,
right.
On Maryland Parkway. And what's the office number?
277. Oh, the address is 2770 South Maryland Parkway, Suite 212, and it's 89109. And office is 702-706-6009.
One more time.
702-706-6009.
And if they wanted to go to lvacrc.org, they could go online and see your resources as well?
Yes. And right now we're kind of revamping our website because we have to look for someone that knows IT, which we are not one of those people.
So if anybody wants to volunteer their IT time.
Yes, please, that knows about websites, because we know nothing about websites. Our website was started by someone from the Department of Education.
Oh.
And unfortunately, she left Las Vegas. But most
You know
of our
what?
people are run by volunteers, and I love them. I love the
Volunteers are great, but IT people, they know how to get you. We just changed our domain name, and our tech deleted my email address instead of forwarding it to my new domain.
Oh, no.
I'm like, dude, what's going on here?
Oh no! Yeah, no, we are, and my young volunteers and our intern, they're all hip. They do the Facebook and the Twitter, and I just say, okay.
Just make it appropriate.
I know, exactly. Just don't post my picture.
Oh no.
So please come and visit. We're open from 9 until 5, sometimes 6. It depends on the appointment, because sometimes some people work in the casino and they can't get out a certain time. So we do that too.
Well, that's wonderful. Those are great resources.
They are. Yeah, we have counseling people. We have for the medical, of course, we have the counseling. We have your clinic. We have the home care people as well.
Yes.
Then legally, of course, we have all our attorneys in all kinds of field, whether it's from immigration to criminal. Yeah, they go from one extreme to the other. And I'm a paralegal, so I kind of try to help them first before we send them to the right attorney.
So she is what she says she is, a resource center.
Exactly. So,
And if you're looking for resources, you don't have to be Asian. But the point is to combine all the different fragmented communities in the Asian population and let them know that there's one resource point.
Yes, definitely.
Excellent.
And can I plug in our ACA, our Affordable Care Act?
Go for it. Go for it, because it's open enrollment time, right?
Yes, November 1. Please, anybody there who does not have any insurance and think they can't afford it, please give us a call, because we can help at 702-706-6009. And starting November 1, you can enroll for the Affordable Care Act program. And we're proud to say we're the only Asian organization that has been awarded that grant as well. So
insurance as a whole is confusing.
Oh, my goodness.
So, and if you have a language barrier on top of it, you absolutely have to go to 2770 South Maryland Parkway, Suite 212, to the Asian Community Resource Center, or call 702-706-6009, and they will be more than happy to walk you through the process.
Yes. And Medicare is also open enrollment right now.
Yes.
So please come, Medicare, Medicaid, whatever insurance. And we work with insurance brokers as well. So,
wonderful.
Please, health is very important.
It is, because culturally the diet changes so much when you come here.
Correct.
It's really important. We find a lot of diabetes in our Asian population that wasn't there before.
We have to give up our soy sauce sometimes.
High sodium.
Yes.
And the starchy little sticky
rice.
Sticky rice. No bueno.
Oh, Tina.
No sticky rice.
Broke our diet.
I know. Well, when I tell the Hispanic population no refried beans with lard, they look at me like I have a third eye.
Really?
So, so I teach them how to soak them and make them healthy. Do the same thing.
I know. I'm actually running also another series of Asians and diabetes.
So this is wonderful. Anything else? Tell us about the Asian diabetes real quickly.
Oh, and we're running another series about that because, as you know, we eat a lot of rice. So
yes,
that's a very, very good example. Also, last plug, if I can.
Go for it.
I don't know when this will air, but tonight.
No, it airs Sunday.
Oh, it airs Sunday. Well, there's a new demographic study that's been put out there to those of you who are marketing people, clinical people, people who need to know where the AAPI community is in Las Vegas, in Oregon, in Arizona, in Nevada, and California. It's divided into so many
So the new book is out.
The new book is out.
And you need to contact Emily at
Yes,
ACRC in order to get a copy of it.
Yes, and we'd be happy to send it to you.
Wonderful. Thank you very much.
Thank you so much, Tina. This is wonderful.
This is Tina with First Person Care Clinic in Healthy Las Vegas saying thank you. And thank you, Emily, for coming and joining us today.